In this video, we are going to examine the oral cavity. In this torso model, we can see that half of the bones of the face have been removed so that we can see inside the oral cavity. Here we can see the incisors of the maxilla and the mandible. Right. The maxilla, as well as the palatine bone, make up the hard palate. We can see that this is sectioned through bone. And all the way to the posterior side of the oral cavity, we can see the soft palate. And, of course, we can see the uvula. Uvula way back here. Here is the tongue. We can see some of the glossus muscles here, which actually control the tongue. Okay. What I want to point out now is this kind of yellow chunky tissue here. These are representing the salivary glands. These are extrinsic salivary glands that are only triggered to release saliva when the thought of food occurs, or when you smell food, or when you're actually ingesting food. There are 3 pairs of extrinsic salivary glands. This first one here is the sublingual, because it is sub under the lingual, the tongue. Okay. Next, this over here is the submandibular salivary gland. We can see here that the mandible has been cut and removed so that this would actually be under the mandible in reality. All right, if we take a look at the other side of this model, we can see that there is a third, and of course these are all paired extrinsic salivary glands. This one here is the parotid salivary gland. Okay, one more perspective that we can have of the oral cavity. This is a model that we know and love for sure. Again, these are the incisors, hard palate, soft palate, uvula, the tongue, and of course the glossus muscles, which you're not responsible for this class, but maybe you learned about them in A&P 1. At the posterior aspect of the oral cavity, we have 2 pairs of tonsils, the lingual tonsil attached to the tongue, as well as the palatine tonsil on either side of the isthmus. This tube here is the oropharynx and the laryngopharynx, and then finally, after swallowing has occurred, the epiglottis flaps down to block passage of food and drink into the respiratory system here, so that food and drink is diverted down the esophagus. So this here is the esophagus.